This is about health and technology, and it's really to understand, to talk to people, how they really envision the healthcare of the future, how they want to drive the new health and well-being. And it is about talking about different possibilities, different scenarios. So, no use of technology, so kind of old traditional way, full use of technology where you don't interact with humans at all, and just with the technology, for example, for self-diagnosing some symptoms, or partial use of technology, so some use of technology but still interaction with the human. And of course, each one of the scenarios has its own pros and cons. And this is part of the work that we do at the Innovation Value Institute at Maynooth University on digital health for transformation for person-activated health and well-being. And we are working on person empowerment, on health and well-being that is enabled with the use of responsible AI. And we are here so discussing about the future of the health and well-being driven by people, and about different digital health technology and trends. And we are also showing different technologies from the application that we are building about a conversational health agent for person empowerment, where we show how we help people really to understand their symptoms, their possible diseases, and better interact with medical professionals. We can also just go to Google, for example, so for search for health information. Many people go, but what do you do after that? Or we can also use an application for self-diagnosing symptoms, and it's a very powerful application, and you can try to self-diagnose yourself, but also important what you do after when you get this information. And also interesting, there is also some technology that is a voice-enabled technology, where you have some chatbots that helps you, for example, to also self-diagnose. You can talk to this chatbot and try to understand what's going on with your health. Other technologies that we are using, for example, smartwatch with monitoring some vital signs like blood oxygen, breath rate, stress level, and so on. Very useful, but also important what you do with this data. And the last but not least is virtual reality that is becoming, and reality is becoming very important, where you are using this virtual virtual reality headset, really to interact with many applications, and it's going to be used more and more in the healthcare and environment. So you see different technologies, different ways of using technology, different way of balancing the human interaction and the technology interaction. And this is what the work that we are doing in the Innovation Value Institute, as I said before, and we have the digital health cluster, where we have a vision. We work with different partners from industry, from healthcare organization, from academia, in order to bring along this vision to explore what is really the future of people-driven health and well-being. And if you're interested to join us and for the discussion, to join us in our activities, please contact us.